And what sort of test is done to determine an allergy if you're not having a really big reaction? But we're seeing, you know, hives or blisters,
Yeah.
or what's to test for what it is?
So we've got two types of testing in New Zealand. We've got our skin prick testing and we've got our EASE testing to confirm what the allergen is. We don't order testing without a history, so it's really good practice we're only just doing it to confirm the allergy. So if your child has reacted to likely peanuts, that's the allergen we would test for, because it's not helpful to have a large panel of different foods. But in terms of the testing, we prefer skin prick testing if we've got access to it. And what that test entails is small little droplets of the allergen that the child is suspected to be allergic to, and we do a slight prick through the skin. It doesn't cause any blood or anything whatsoever, it's just a tiny prick through it. And then we read it 15 minutes later. And what we're expecting is if they're allergic to that food, there'll be a localized reaction, and we measure the size of that wheal. And that gives us an indication as to the likelihood that a child will react to that food. Doesn't tell us what kind of reaction they would have, but the likelihood that they would have it. We do sometimes see in our eczema patients that they will get lots of skin prick testing done because they're wondering if the foods are causing eczema. We don't encourage that to happen. In skin prick testing, you can actually get positive results for a food that you're tolerating all the time. So we wouldn't encourage that as good practice. It's just really good practice to confirm the allergen. And then we do skin prick testing consecutively over time. So it gives us an indication, is this child growing out of this allergy? And if so, is it appropriate to do a food challenge in hospital to see if they've outgrown their allergy now? Or if the antibody's completely gone, great, they could try their food at home. The alternative we have is our blood test, and that's called an EAST. And it gives us similar results. It tells us how much of the IgE antibody their body has made against that specific food. But skin prick testing would be our gold standard